Welcome back. With more Singaporeans choosing uncommon destinations for their year-end vacation, some doctors here have seen an up to 20% spike in travel vaccination requests. Cheryl Goat finds out where, when, and what type of vaccination exactly you'd need.
29-year-old engineer Joshua Ang and his wife are making a once-in-a-lifetime trip to Ethiopia. And while the couple spent time planning, Mr. Ang said, as with most of his holidays, he didn't quite think about vaccinations at first.
Actually, no, we would not have thought about it. It was through a friend who travels to Africa quite often. And he told us that we actually had to go and do a few vaccinations before we left. And yellow fever is required because if you don't do it, you can't actually come back into Singapore.
Mr. Ang also opted to get typhoid, hepatitis A, as well as meningitis jabs, which are recommended but not mandatory. And with more Singaporeans like Mr. Ang travelling off the beaten track, doctors say it would be wise to err on the side of caution, regardless of their destination.
Japan has its rubella outbreak now. So whilst they are fairly clean and they're fairly developed, before you go traveling, you need to check whether they have outbreaks and if they are preventable via vaccines. So while we have the destination, we actually look at whether there's outbreaks around that area and then what activities they'll be doing and hence what their risk will be like.
A lot of people think, all right, if I travel to developed countries or if I travel to neighboring countries, I don't need to be vaccinated. But I think it's always good to prevent the disease from happening.
The yellow fever vaccine is compulsory for countries in South America and Africa. Other more commonly recommended jabs include those that protect against hepatitis A, typhoid, Japanese encephalitis, a mosquito-borne viral infection, as well as rabies. Some vaccinations also don't need to be done each trip.
Even if you do travel, 3 or 4 times a year, you probably don't need to vaccinate yourself every time you travel because vaccinations, there are a certain valid period. For example, flu shots, right? So every 6 months to 12 months. Hepatitis A, it can last you maybe 8 to 10 years.
Most vaccines need to be administered 2 weeks before travel. But to be safe, doctors advise travelers to start preparing 6 weeks in advance. This is because some vaccines require multiple doses. For instance, if you're getting a rabies vaccine, you would need to get 3 doses over the period of 1 month.